Klein, and I am the Scientific Director for the Transplant Therapeutics Consortium at the Critical Path Institute. In 2017, the TTC was co-founded by the American Society of Transplantation and the American Society of Transplant Surgeons as a collaboration between the transplant community, industry, and regulatory agencies. This consortium is one of the 17 public-private partnerships at c-path, and the TTC achieves its mission as part of c-path by acting as a neutral third party to bring together members from the community, industry, academia, nonprofits, regulatory agencies, advocates, in a pre-competitive collaboration with the primary goal of identifying and addressing the regulatory challenges that impact the development and approval of new therapies in transplantation. This public-private partnership facilitates sharing crucial data and resources to advance drug development in transplantation and allows regulatory agencies to engage with stakeholders in the field to solve challenges in kidney transplant drug development. As the scientific director for this consortium, I work with consortium leadership to develop and execute strategies and priorities for the TTC, which allows me to see the big picture of all the initiatives in which we are currently engaged, and then communicating these initiatives with our internal team in order to prioritize the next steps. Day to day, I work with an incredible team of highly motivated project managers, data scientists, pharmacometricians, and regulatory experts to ensure the procurement and curation of historical de-identified patient-level data from the biopharmaceutical industry and individual transplant centers across the globe. And these data will provide the scientific underpinning for drug development tools as solutions to unmet needs in immunosuppressant solid organ transplant drug development. What excites me most about the work I'm doing is centered around working with an excellent team with different skill sets. We are all learning from each other and working together on a common goal, ultimately improving the lives of transplant recipients across the globe. I come from the clinical practice setting and have taken care of patients living with a transplant. I understand the hardships they face day to day in terms of taking medications that often come with harsh side effects and fear of losing their incredible gift of a new organ. While taking care of patients during one-on-one appointments is incredibly rewarding, my role in the TTC allows me to hopefully serve patients on a macro level through our current efforts of developing tools in clinical trial design that can be used to accelerate the development of new therapies with better long-term outcomes for transplant recipients. So for me, this position is very humbling and an incredible opportunity to collaborate with the international transplant community to improve the lives of individuals living with a kidney transplant. Thank you.